My talk is about empowering your teens to take care of their own medical care, or as I like to call it, hanging on and letting go. I have a bit of a cough, and I get it when I'm talking a lot, so I apologize up front if that happens. I have another disclosure, which is I will use children, teenagers, patients, young adults, and they all mean the same thing. They mean your children who have congenital heart disease, or yourself if you have congenital heart disease. And I also recognize this is easier said than done. And I think after Megan's talk, I realized I'm a bit of a fraud, and really Megan's parents should be giving this talk today, because they've obviously done a great job. So you've all been in this position. Who in this room has infants under the age of 1 with congenital heart disease? So you don't have to worry about this quite so much yet. What about school-age children? So good. So this is going to be the focus of the talk. And you know what it's like to prepare them to go to school, to ride their first bicycle, to be teenagers. Who has teenagers? Oh, good luck. All right, and I've already discussed this with one parent today. Transition is not transfer. And I know Megan's talking about following up in the adult congenital clinic, but remember, transition is preparing the child. It's not necessarily transferring them to another provider. Your provider may be a pediatric and an adult congenital doctor. That doesn't mean you don't transition your child or your teenager to become more independent and take care of themselves. And transition has a nice fancy definition, but really it's a shift in the responsibility of healthcare management from the family-centered care to patient-centered care. And that's really what we're talking about today. And it's to make them feel supported so they don't feel like they're being booted out from the children's clinic to the adult clinic. You're going to help transfer them, whether it's to the same provider or to a different provider or a different institution, but they have to feel supported during this process. So what is healthcare transition? So it's a critical part of transition to adulthood, but it's not just healthcare. I mean, I think Megan discussed this very well. It's also their education, it's their training, whether they are allowed to work indoors or outdoors with their heart condition, especially here in Florida, where we have very hot, miserable summers, as though you couldn't tell. We have a lot of patients that we have to say, you have to figure out a job that you can do indoors because you'll not be able to work outdoors. You'll not cope with the dehydration as well. You won't be able to do the physical impact jobs that you may want to do. It's dealing with the psychosocial and interpersonal issues that Megan mentioned and preparing them in many cases for independent living. And our focus on transition is to make sure that your young adults continue to have adult care. Megan mentioned about the importance of establishing care when she went to college. It's making sure that patients are not lost to follow-up. We often see a lot of patients drop out of care when they're 16, 17, 18, they're feeling okay, they go to college, they move away. And quite often when they come back into care, it's either because they're getting married, or in the men's case, their future wives will bring them into care. And in the woman's case, it's because they want to have a baby. Or unfortunately, it's because they're having symptoms. So really what we want to do is to make sure that we continue to follow them to prevent that gap in care that may lead to problems or complications. And we do this by hopefully increasing the knowledge and preparing the patients about the importance of compliance with medical care. We emphasize the adult health issues that Megan discussed, the lifestyle issues, starting to talk with our 13, 14, 15-year-olds about employment, talking about insurance, talking about having pregnancies or children, medication, and reminding them that just because they've had surgery and I know this is a Mended little heart group, but they have congenital heart disease that's had surgery, but they're not fixed. And that's something that we have to work as a whole community to enforce. You still have tetralogy follow. I get 40 or 50-year-old patients come in, and I say, what's your heart condition? They go, I had tetralogy follow. Well, that's not really the case. You still have tetralogy follow. You've had surgery, the plumbing's better, but you still have the underlying spectrum of the disease that we have to take care of. And when should transition occur? It's an ongoing process. So even the mother of the little baby in the back who has a 1-year-old who's thinking, I don't have to transition for another 12 and a half years, I don't think that's really the case. It's starting to incorporate that congenital heart disease is part of their facts. Like Megan was a gymnast and that was part of her life, and she had congenital heart disease and that was part of her life. It's something just to incorporate into your life without making it the identifying factor. And you have to make sure that they don't feel overwhelmed, so it has to be age appropriate. There's no point telling a 5-year-old that they can't get pregnant, but you can tell a 5-year-old that there's no reason why they can't go out and run with their school friends in recess. So it's making it age appropriate and making it relevant to their lives. And it's a gradual process where children, even at a young age, can start talking with their doctors and asking them questions. In the group, do you find your pediatric cardiologist talk to your child more or to you more when you're seeing them in clinics? Who thinks that pediatric cardiologist speaks more to the parent than the child? Okay. Who finds a pediatric cardiologist speaks more to the child? And when they do, who answers, you or the child? Okay? So remember, when the cardiologist says to the 7-year-old, how are you feeling? Give them a chance to answer. It gives them that confidence that their voice will be heard. Okay? Just get them more involved. They may not be able to give them all the facts. They may ignore the fact that they had symptoms a few weeks ago, but at least let them get started with answering the questions, and then you can fill in the details. And then as they get older, we get them more involved with remembering their medication. We have a nurse in our clinic who won't sign off on driving license unless they can name all their medications and all their dosage. So you can blackmail them as well. That's not too bad. And it's a challenging time for the patient and for the family. The patient, the teenager, the young adult is overwhelmed by new responsibilities. They're, just like Megan said, taking care of themselves, helping to make medical decisions, being advocates for themselves. When their parents had been the ones who spoke up for them, they are trying to speak up for themselves. They're sometimes confronted with the realities of increasing morbidity, whether it's or mortality, unfortunately, whether it's because a friend of theirs from camp, or whether it's a friend of theirs from the hospital who they've met, or on Facebook they've heard of somebody who's passed away, who's had more surgery. They're having to deal with that for the first time. They need to unlearn pediatric behaviors. So they need to move away from relying on their parents to make the decisions for them, making the appointments for them, and need to be responsible in a more adult way, taking some decision-making into their own hands. So our goal is to increase self-responsibility, but that to still provide support and help them out as they make these decisions. So, my parents were both teachers, so they said the best way to engage an audience is to ask them questions. Who do you think is responsible for transition? You can all speak up. It's late in the afternoon. Sorry? The parents? Everyone. Okay, well, that made it easy. Okay, yeah, everybody. So the patient, the pediatric cardiologist, their friends, the adult congenital provider when they follow up in the adult clinic, the family, the school teachers, getting their ILPs done, making sure that they're appropriate for age when they're in college, getting the disability folks involved, the CT surgeon, making sure that he or she doesn't pass on the message that you're fixed or you're operated on and you don't have to be followed up again. It's an ongoing process. The community. Transition is not unique to children with congenital heart disease. Transition is to all teenagers, whether they have congenital heart disease, a chronic illness, or no illness. They have to prepare for being self-sufficient adults. Patient networks like this, or the Adult Congenital Heart Association, the media, there's no reason why we can't rely on more support from everybody. And as they say, it takes a village to transition our young adults to independent care. So our goals for successful transition are to improve patient outcome, make sure people aren't lost to care, improve patient education. There are studies that show that even when patients thought they knew the answers, they had either heard or had been given wrong information. So make sure you know the right information, whether it's getting second opinions. And to comment on Megan's statement, if you want a second opinion, no cardiologist would be insulted if you got one, and quite often you can ask them to help you get a second opinion. So don't be afraid to do that. So it's a preparation for adult life. So the educational curriculum has to emphasize the aspects, the unique aspects of cardiac health, the unique defect, the treatment history, the surgeries the patients have had, the important signs and symptoms to look out for, what are the healthcare expectations, as well as the preventive health measures. When we talk adults, we're not just talking young adults, we're talking 40, 50, 60, and 70-year-olds with congenital heart disease. So we have to start thinking of cholesterol and making sure we exercise and all the things that we're all supposed to be doing, as well as the other lifestyle issues that Megan's mentioned. So what are the strategies? This is kind of the practical portion of the talk. What are the strategies that you as parents and we as providers can help your children, your teenagers, your young adults to become more involved in their own care? So education. They can start learning the name of the diagnosis and the surgeries they've had. You can start that as young as 6, 7, and 8 years old. We have a 7-year-old who, since he was 5, can tell me the name of all his medications. He did call Captopril Craptopril, but other than that, he knew his medications. Let them know the name and the purpose of medications. If a young person knows why they have to take a medicine, they're more likely to remember to take it. Letting them know that you may not feel symptoms if you don't take your Captopril for 2 or 3 days, but the reason you have to take it is to prevent problems down the road, potentially depending on your heart condition. Give them the reasons why we have regular follow-up in clinics, so we're looking for signs and symptoms that they may not even be aware of, that they don't realize are related to the heart, so we can pick up subtle signs so that if we have to adjust medication or do an intervention before they become more symptomatic or sicker. Get your young teenagers involved in medical planning. Have them have input in the timing of medical visits or procedures. It could be as simple as, do you want this halter put on a Monday and wear it to school, or would you rather put it on a Friday afternoon and not have your school friends know about it? It's a decision that we in clinic will say, oh, we put on a halter and we take it lightly. But for the teenager who doesn't want to wear it to school, it's a big deal. So there are lots of things. Unless it's an emergency, most things are somewhat elective, and most things can be adjusted to suit your teenager or your young child's medical care. If you're on a once-a-day medicine, would you rather take it in the morning or would you rather take it in the evening? Again, most conditions and most medical issues and most medications, that's not that big a deal. It just has to be consistent. So there's no reason why you can't involve your young adult or your young child in that decision. And use clear and effective communication. So we all say, do you have any questions as we're walking out of the room, right? We all do that. You go home and you don't probably address the clinic visit with your child again. So ask them specific questions because they may have heard something that wasn't meant, or they may have interpreted it in their own way. So instead of saying, do you have any questions or concerns, we as providers and you as parents should say, what are your questions and concerns? You know they have them, so bring them out, discuss them, and make sure there's no misconception. Instead of saying, do you understand the information they told us, and that's a uh-huh. Yeah, I know teenagers. You can say, what did you understand about why you're having a heart cath? So ask questions that are not yes and no questions to engage them and find out what's really on their mind and what they're really worried about. Prepare a written health transition plan, and I know you discussed it, so that's perfect. And that can be created. It does not have to be anything formal. It does not have to be anything set in stone. It can be adjusted as things change, but have a plan. When I'm 14, I want to know all my medication and my medical history. When I'm 16 and I'm applying to college, I'm going to look at colleges where there's an adult congenital program. Whatever it is that's relevant to your child, your teenager, have a plan that you can use and that you can modify as needed. Review it and update it. You can make it at home and show it to your cardiologist or your physician, or you can just have a personal one that you follow at home or your teenager follows at home. Have them carry a health passport. So the Adult Congenital Heart Association has that passport on the right, which I don't think anyone carries. But there's no reason why they can't put information on a smartphone or a Fitbit. I carry a road ID that has my information in case anything happens to me. And it's more about empowering your teenager or your patient with congenital heart disease to become more independent, be aware of issues that may occur, and have the information available if anyone needs them. The passport is really a good workbook. I have a few of these workbooks that were prepared by the folks in Denver. If anyone wants I have a few copies that you're welcome to, or you can apply to them to have copies sent to you. I don't have a plug. They just sent them to me this week, and they're really good, so I thought I'd share some with you. Give your teenager a chance to gradually assume responsibility for their own health care, whether it's communicating with their doctors, whether it's making their own medical appointments, whether it's maintaining their own medical records. You're still going to be overseeing them, but it's better to have them start taking more responsibility while they're with you at home than when they're 21 and they've gone to different city and they may not be following up with cardiologists and you're waiting for his wife to take him to the doctor in 10 years' time. So just get them more and more involved while they're under your supervision if you can. Help them prepare for appointments. Have them write down questions ahead of time. Why am I taking this medication? Or what happens if I forget to take a couple of doses? What are the symptoms I'm supposed to look for? What are the next tests I'm going to be doing in the next 2 years so I can budget for it or prepare the time? Why am I coming back in 6 months and not 9 months like I used to? And lifestyle concerns. They can specifically ask their provider specific questions related to their own health and limitations. And have them be prepared to discuss the symptoms, so whether you want to have a dress rehearsal in the car on the way to the clinic, or whether they prepare for it a few weeks in advance and write them down so they have time to think about it, that's going to be individual to you and your children. Have them be honest. A lot of patients hide symptoms because they don't want to deal with it. I have patients who know the minute they tell me they have palpitations, I'm going to put on a halter so they don't tell me they have palpitations, right? So I specifically have to question them 3 or 4 times to make sure that they don't admit it, right? Am I right? Yeah. So have them be honest. Have them be honest if they are smoking and they're short of breath. So I have patients who say they're short of breath. These are adult patients, not your children. Sorry. I have patients who keep coming in saying they're short of breath, and every time they come in, I'm worried about their heart, and I'm worrying about the rhythm, and I'm worrying about the fontaine, and they've been smoking for the last 3 years and have never told me. And it's my fault for not asking because I assume they didn't. But have them be honest and admit all the issues. Be an active listener. So encourage your teenager to be an active listener. So have them, and you will start doing this when they're young, but when they're older, have them do it as well. Have them repeat a summary of their understanding in their own words. So when I go, blah, 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 heart cath, blah, 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 they need to tell me, I need a heart cath because you are looking for the pressures in my heart. So I want to make sure that they understand what I've just said to them. This reduces any chance of misunderstanding and avoids the mind reading that we all do when we go to the doctor. And let your teenager let you know when they agree and disagree. I know they let you know when you go home, but have them discuss it in the clinic visits so that if there's something they're not going to do at home, there's no point me sending them home on a medication thinking that they're going to take it when they're not going to take it. So if they're really not, I'd rather know up front so we can work around it. And medical home is a word that you'll hear on and off. Basically, it's any provider who is your core provider, whether it's your primary care doctor, whether it's your internist, your adult congenital provider, your pediatric cardiologist, your surgeon, someone who knows your overall medical health. So that's something that, again, encourages your children to have a place where they feel comfortable bringing up issues they may not feel comfortable other places. Have them attend transition events, whether it's events like this, whether it's a local institutional event. Different hospitals have different setups. Sometimes it's a cardiology-only event where we try and empower our young adults. Sometimes it's at a local camp where we have events. Sometimes it's all 12 to 15-year-olds being seen in Hospital X will have this transition event to prepare them for adulthood. It doesn't matter if they have heart disease, cystic fibrosis, diabetes. It's still the same principle. It's being more responsible for your own health. So try and find out what your local events are and get them involved in that. And celebrate it. Transition is the same as getting your driving license. It's the same as graduating high school. It's being prepared and getting ready for your adult life. Have PreTransfer Clinic. So if your children go to an institution, which is a pediatric institution where they have to transfer at 18 or 21, going to pay a visit to the adult clinic is not unreasonable and can be arranged with your local clinic. And let your teenager or young adult know that it's still okay to include them. So you can still go with them to their clinic visits if they want you to. I know that's hard for the mothers of the infants to understand, but at the age of 18, you do not have to go in to sign them in, and you, by law, are not allowed to ask questions unless you're given permission by your child. That said, quite often they want you there, and they should want you there. Make sure that you feel comfortable offering your help. Make sure they feel comfortable having you there if they want you there, and let them know that it's okay to ask you if they choose to. Have a definite role. So when you go to a cardiologist and your child is 19, they will be the focus of the discussion. Not to point any fingers, some folks have a hard time with that. So the 19-year-old should be the focus of the clinic visit, same as the 16-year-old should be the focus of the clinic visit. And you're there to write down the information, to ask the questions at the end, to record the information so you can discuss it later. But remember that the child is the focus of the visit. So again, to optimize transition, it takes all of us. Every single one of us in this room, everyone in the community, our friends, families, should be involved in optimizing transition to prepare our young congenital heart patients to adulthood. This is a summary of what I've already discussed. This young man is a 25-year-old I've taken care of for 10 years, who's now become a professional photographer, and he has done a fantastic job taking nature photos, and I want to thank you all for your attention.